Welcome to Be Well. Be Well is a program of the Y to support living a mindful, vibrant, well life. I'm your moderator, Dr. Jonathon Collopy, Executive Director of the Ryan Family Y. Today, we have an important conversation to bring forward related to back to school success. We're about a month or so into school starting up for the fall session, navigating that transition back to school after several years of very different schooling, academic experience. So today we are fortunate to explore some tips, strategies, resources to truly support a successful school family life experience. I'm very honored to have our guest today, Dr. Willough Jenkins. Dr. Jenkins, thank you for joining us.
Thank you for letting me be part of this conversation.
You're more than welcome. I appreciate you lending yourself to this topic. Dr. Jenkins is a Canadian and American board certified psychiatrist specializing in child psychiatry. She's also a pharmacist and thus has a particular focus related to psychopharmacology. She currently works as the Psychiatric Emergency and Consultation Liaison Service Medical Director at Rady Children's Hospital in San Diego. In addition, she's assistant professor of psychiatry at the University of California, San Diego. And she is also a parent of 2 young children. And she was just sharing with me about her start to school as a family. So there's a lot to bring forward in our conversation. So wonderful to have you. As we were talking about, these last couple of years have been very challenging in some ways. I remember there was an article you were cited in the Union Tribune this week, talking about the challenges of the pandemic the last couple of years, and really that amplified some of the concerns and issues for youth and students, but those issues were there previous to that. So if you would provide some context, Dr. Jenkins, in terms of what has gone on and where we are right now.
No, absolutely. So yes, we have been in a mental health crisis for youth and children, unfortunately, for quite some time. And this was going on even before all of the stressors that the pandemic brought for all of us. So what happened with the pandemic is it really amplified an already existing problem where we were struggling with seeing so many more children and youth coming in for mental health needs, even in the hospital, really acute setting. The pandemic brought its challenges, as we all know, where there was the concerns about COVID and then all the secondary effects, the school closures. A lot of us lost jobs or had job changes or were under financial stress. So it really impacted families. And we're at the point in the pandemic, oh gosh, almost going on 3 years, where unfortunately a lot of children have lost family members to COVID as well. So then there's this element of grief and loss. So there were so many factors related to COVID. And then additionally, there were all these other things that were going on in the world, things related to climate change, racial injustice, political tensions, and especially for our older teens, these were things that they were really getting involved with and were really impacting them, and they were taking it on. So it was kind of a perfect storm of things that have been going on. So absolutely, and like the problem's gotten worse, and we're seeing more and more children coming in mental health crisis. At Rady's, we're hitting record numbers of children coming into our emergency room in acute needs. Wait lists are very long to get help. So the needs really continued. What is nice, though, is we are at the point where some of the restrictions and stresses of the pandemic have subsided. Children are back in school now. A lot of activities and supports for families have been able to continue. We have a subset of children, that were needing regular care, maybe for developmental services, different types of therapies. Those were interrupted for a period of time. Those are all thankfully kind of back happening now. So we are in a bit of a period of recovery. And so there is a lot of hope, but it's still a time of transition. So a lot of children, are still having a difficult time and needing some additional support, or families are kind of noticing the impacts more that they're back in some of these activities in school settings.
So in thinking about our conversation today, I was reflecting back to my youth and when I would get ready to start school in the fall. And, typically there'd be a little tentativeness or even a little anxiety about what that is, that unknown, who's my teacher, and, classmates and all of that. So if you could just share, what is like a typical transition back to school? So parents and caregivers can kind of distinguish between what is typical and maybe what might be representing as maybe some challenges.
Yes, well, you bring up a good point because anxiety is normal. All of us experience it at some time. All of our children experience anxiety at some time, and it's not always bad. Sometimes it's a really good thing. That being said, back to school jitters, a little bit of nervousness, anticipation is all completely normal, especially if they're going to a new school, starting school, like going into kindergarten or starting a middle school or a high school, those big transitions. It's pretty darn normal to have a little bit of anxiety. And that makes sense. You're entering a new situation. You don't know what you're going to encounter. So a little bit of resistance, especially on the first few days, a little bit of like having trouble maybe sleeping the day before. These type of things are all really normal in terms of back to school anxiety or back to school jitters. And honestly, most children have a little bit of back to school anticipation, even if it's kind of an excited, nervous energy, because they are looking forward to it. When things start to become more problematic is when potentially even before school started, if you notice your child was very resistant to the idea of going to school, they were maybe avoiding some of those fun things, like back to school shopping if you were in a position to do so, or some of the things like, getting your new outfit ready, some of the things children enjoy, if you notice a big resistance there, or their anxiety about school started way back, like going back a month or two into the summer, and they weren't really able to enjoy the summer because they were so concerned about school starting up in August or September. So those would have been signs early on, that maybe there was a little bit more anxiety. What's nice about the timing of this podcast, though, is we are a month in. So for most children at this point, that back to school anxiety, that jitteriness should be subsiding. So if your child is still struggling with anxiety about school, they're not sleeping, they're really resisting going, just maybe they're a little bit more irritable, they're getting panicky at drop off, just not wanting to go. Those would be signs that it's probably worth a little bit more of an investigation and look into what's going on, because at about the month mark, most children will have adjusted and that anxiety will have subsided.
Great point and great distinction. That's why I appreciate that, we're a month in. And so what should be seen at this point in time? Would you say, Dr. Jenkins, is it different challenges at different ages? So someone going into kindergarten versus elementary versus middle versus high school, does it manifest in different ways, a challenge at those times?
Yeah, it absolutely can. I mean, younger children will have more difficulty telling you, hey, mom, hey, dad, I'm anxious about school. That's not language they're going to use. You'll probably see more of like a behavioral resistance, maybe more acting up, maybe being a little bit more naughty, or they may say their anxiety physically. So I have a stomach ache, I have a headache, I don't want to go to school. And a good kind of hint that might be going on is that it notoriously happens Sundays, right before going back to school on Monday or in the morning. If they're only having stomach aches in the morning or on Sunday night, that's kind of a sign, oh, maybe that's their body's way of telling you they're having some anxiety. That can absolutely happen for older children too, but is maybe a little bit more typical for younger children who are still learning how to verbalize their emotions and recognize their emotions. Sleep disturbances, anybody, so young or old. And then older children too, sometimes their anxiety comes out more as that irritability. So we all know teens, they can be difficult, but if it's especially they're being really irritable, they're really avoiding things, not, maybe skipping school because they have the ability not to go. Those would all be really good clues, that something's going on.
So you've done a wonderful job of kind of sketching out for us some of the challenges and how they may represent themselves as caregivers, as parents. How can we support, if we took this anxiety, so to speak, how do we support our students, our children in that transition of taking on and working with anxiety? Because as you said, anxiety is a normal part of the process, but when it becomes more debilitative or challenging, what can we do?
Yeah, this is such a great question because there actually is a lot as a parent you can do to support your child if they have anxiety. I think the first thing is to recognize, do you have some anxiety yourself? Because our children are always watching and we can model really good responses to our own anxiety and our own worries, and our children can learn from us and how we deal with stress and things come up. I think the other thing we can do is educate our children on what anxiety is.
Mm.
So anybody who's worked with me knows I always use this analogy, so I'll share it with you. So I talk about what happens when you're anxious is like you're seeing something really scary. So you mentioned I'm from Canada, so I always use the bear. A lot of people in California use a shark, but I always say, like, if you were out in the woods and you saw a bear, what would happen? You'd feel really scared. You'd feel really anxious. And so anxiety is like, you feel like there's a bear there, but the bear's not there anymore. So your body's signaling to you there's a danger, there's a fear, but there actually isn't something still there. And
Mm.
so that it's really important we learn how to help your body fight back against the anxiety and learn skills, because unfortunately, if you leave anxiety and you don't deal with it, you avoid it, you don't go to school because it seems scary, that anxiety grows. And so I say, like, my job, either as their psychiatrist or sometimes as a mom, you mentioned I'm a mom, is to really help you learn how to fight back about that, against that anxiety. That's my job here. So it kind of helps to frame it that way for a child. If they think, gosh, mom, you're kind of being like, you're really pushing me. Like, can't you see I'm sad? Can't you see I'm worried? It's like, no, I'm doing this because it's my job to do this, to help you fight back against this anxiety. So that's some really helpful language that I found. You'll hear a lot about, like, oh, just ignore it. Don't put too much attention on it. And while I agree that I think it's important not to feed into the anxiety yourself too much, I do think it's really helpful to communicate to children, adolescents, why you're doing that. Otherwise, it can seem really insensitive. So that's why I do kind of that preamble of, like, I'm doing this to help you. It's my job to do this to help you fight back against the anxiety. So that type of language can be adapted for really young, like 5-year-olds, or really all the way up to adults, and kind of what your role is in helping support them with the anxiety.
How wonderful at an early age, as you're speaking to equip a child with those skills, because anxiety is going to present itself throughout life. And so you see in the adult population, high incidence of anxiety. And so to allow children to gain that resource early on, normalize some of that, but have those tools that they can utilize and employ, so important. If I could, I'm thinking about other challenges that may present and how to support people in their children being successful in school. And I think organizationally, each class, you kind of up the ante in terms of asking for greater independence and management of one's assignments and whatnot. So what kind of support would a parent offer related to just managing school life?
Well, I think the first thing that's really important is to make sure that your expectations of your child are realistic. So, if you have a child who has an anxiety disorder, or who has ADHD, or who has some sort of learning difficulty, that you're adjusting the expectation. Now, I'm not saying it has to be a lower expectation, but that you're being realistic in what you're expecting of your child, depending on your individual child, because what might work for my child probably won't work for your child. It does have to be fairly individualized. So once you know your child and you know what type of support they need, for example, maybe more support in keeping organized, making sure they know when assignments are due, when homework is due. And there's a lot of different strategies that you can help support your child with, whether it's through the traditional agenda, which I think most of us grew up doing and children kind of balk at now, or you have a calendar that's posted that you help them kind of manage some of the organization. Or if they're more independent, you teach them the skills to do that themselves. So it very much kind of depends on where children are at and what their individual needs are. I think, though, that definitely connecting with the school is something that a lot of us feel a little apprehensive to do. You don't want to be the squeaky wheel that's always in asking the teacher what's going on. But you can get really helpful information on what the teachers are seeing as your child's strengths, or what are areas that they see could be improved upon. And so definitely having that dialogue. Most teachers have emails, sending an email, letting them know you're really interested in hearing ways you can support your child with their learning. And then making sure that, of course, you're giving positive feedback to your child too, on how they're doing and what you're seeing. So kind of a long-winded answer because it's so individual, but I think there are definitely a lot of different strategies and ways, but absolutely involving school is going to be really helpful.
That's excellent. I also, as you were sharing, I'm just so aware that life is busy for parents as well. And so I just look at how parents engage in the process, their own kind of self-management. So in some ways, if you could share a little bit about how parents can show up and the significance of how they are with their children. You've touched on it a little bit, but just in the sense of how significant that is.
Yes, I think that brings up a good point, because the last couple of years, I think I've really stressed everybody, not just children. So if you're in a position where you're caring for children, it's busy and it's stressful on top of whatever other demands life has. So making sure that you're taking care of yourself, looking and evaluating, do I have some unmet needs? Have I taken care of my own mental health, my own mental wellness? Am I in the best space that I am in to be able to be there as a parent for my children? And sometimes that means taking time away from your children to care for yourself, which can be a challenging thing to do, especially if you're someone who's working a lot, because you feel like, gosh, I've got to be there for my kids. I don't have time to go to the therapy appointment every week. Like, that's going to take even more time away. But making some of these kind of time sacrifices can be so helpful, because children really care about the quality of the time that you spend with them, not so much the quantity of the time. So if you're able to really dedicate some quality one-on-one time with your child, and even if for you that's half an hour once a week, that's much better than 4 hours of distracted time, where you're on your phone or trying to work or trying to do something at the same time, which we've all done. But I think that's really helpful to have that one-on-one, really quality connection time where you're putting away devices and able to really focus on them. And I realize, of course, with this, depends on how many children you have, what your situation is. But if you're able to carve out a little bit of one-on-one time with your child and make sure that you're taking care of yourself, I think that really sets up for a really positive kind of parenting experience. The last thing I'll say is there's no such thing as a perfect parent. So if you're somebody, and I imagine if you're listening to this podcast, you're someone who's very attuned to parenting and very concerned about your child, just remember that really you can't be perfect at this. You can do your best. And sometimes we make mistakes, and that's okay. It's just a matter of, being aware and doing what we can. And if we do something wrong or make a mistake, also just acknowledging that to our child as well.
I really like what you said in terms of the quality of the engagement, parent-child, and it's not the volume, but it's really, in that moment, engaging, responsive. There's a term that I hear at the Y that we really promote, connection is protection. And that how important that vibrant, engaging, loving, warm relationship, that responsive relationship, and how that really provides a certain armor for children. So I really appreciate what you've said in that sense. Tell me a little bit about routines. I think about when I was a child coming home from school, my mom would say, you've been inside all day, get outside, be active. And I really appreciated it. It provided a routine and a structure. You came home, you got outside, you were active, and then schoolwork or homework came later on. If you would, share a little bit about just routines as a family.
Yes, and I want to say this, that being able to talk about routines and consistency does come from a place of privilege, because a lot of people have work schedules or permits or or other obligations that do not allow them to have that type of routine scheduling, and that's okay. There's a lot of ways families with non-traditional schedules can make things work. The number one thing, though, if you can routine-wise, that I emphasize is sleep. I think sleep routines are the absolute most important thing that you can do for children's health, both physical health and mental health. So really trying to have a consistent bedtime, protecting that time when your child is asleep. So, for younger children, those early years, we're talking 10 to 12 hours potentially. A little bit older, we're going up to the 9 to 11, but really even up to adolescence, they should not be getting less than 8 hours a night of sleep. So that's the place I always start with. Like, does your routine allow a consistent sleep schedule to make sure your child is getting enough rest? And that can be challenging. There's lots of things that happen after school activities, sports that are going late, early start times to different schools. So that can be a really challenge in itself. Aside from that, I do think that especially if you're somebody who runs a little bit more anxious, you have a child who really likes to know what's happening, you have a child with ADHD, that routine, that scheduling is very, very helpful. The child knows what to anticipate. What's happening next is very certain. And so even if it's as simple as, Mondays, we have a family dinner. I pick you up from school. We'll do some outside time at home. We do family dinner. bedtimes at 8, depending on how old your child is, or 7 if they're a little bit younger. And even if it's that simple of a routine, if you're able to build in something more, like on this day we do this, on this date we do that, that's, a fabulous. Family dinners are also fantastic, but I recognize in today's busy world that can be really challenging depending on when people are getting done work. So even if you can do that once a week, I think that's a really nice goal to strive towards.
That's great. Dr. Jenkins, what other questions do you hear from parents related to any concerns in school? Do you hear of like lack of motivation or anything else that would be important from your professional experience that you'd want to share from what you're hearing as challenges for parents and their children?
I think one of the consistent themes is obviously concern about bullying and children fitting in socially. And so that's obviously a big topic of conversation. Like, how can I make sure my child doesn't get bullied? Or, what if my child is the one doing the bullying? What do I do? Because there's two sides to this. And so one of the biggest things is that connectedness to the school to get a sense of what's happening. And also to make sure you let the school know you have a real openness to hearing any type of feedback, whether it's positive or could be a little bit more negative about your child, just so that the school knows you'd like to hear about it. And also just making sure you equip your child with skills on how to handle some of the negative interactions that can come up. Unfortunately, that's reality. Not everybody is going to want to be your friend. We don't get along with everybody, and that's okay. So talking about what makes a good friend, how to respond if someone's doing something that's not being a good friend. And I'm speaking more for younger children. My own daughter really enjoys a role play. So I'll pretend to be, the child who's not very nice and see what she says. And we'll kind of practice some conversations. So that can be a really useful strategy that can be also quite playful, and engage your child in doing it, because younger children especially like to do kind of pretend things, but just go in through a few different scenarios. And of course, remind them about trusted adults and like who to reach out to, if someone's not being kind or if something's happened at school that they're uncomfortable with. So that's probably one of the topics I hear a lot about.
Right.
Yeah.
If I could, I know there's the question really related to, as we talk about success, at what point should a parent or caregiver look at getting professional assistance and support from a clinician like yourself in the challenges that are presented to them? There's a question, what kind of things require an ER when it's related to your mental health? So if you take a moment to speak to that.
Sure. So I'll answer the first question first about when to know when to get help. I think that help can come in a few different shapes and forms. So one thing is, you mentioned this already, Jonathan, like if you have some anxiety or some stress, I think any child could benefit from learning stress management or tools to manage anxiety, because it's the reality of being human. We have these emotions. So learning any type of skills. So whether that's as simple as some help that you as a parent are doing, specifically working through, a workbook, or learning more about anxiety or talking about it. Then, if you're having more concerns, though, a lot of schools do have school counselors available, and and the teacher as well. So checking in with them if they have suggestions or tips or what they're seeing. Of course, talking to your child's pediatrician. They are experts in mental health as well. Unfortunately, because the volumes are so high, you see so many children that are having different struggles. So they're a really great place to start if you're unsure, do we need more help? Do we want to do more of a wait and see type approach? They can really help you be that gauge. And then, of course, we have outpatient services. So that's seeing different types of therapists, lots of different backgrounds to become a therapist to help with skills. Ideally, seeing somebody that's trained in an evidence-based type of therapy. So for anxiety and depression, that's going to be a specific type of therapy called cognitive behavioral therapy. So that's a really good question to ask a therapist if you're talking to somebody like, are you familiar with cognitive behavioral therapy? Is that something that you're trained in? That's just a good kind of screening question to make sure your child's getting that evidence-based treatment and help. And then if your child's having more struggles and you're concerned that maybe they're completely not going to school, they're having school refusal, they're really struggling with sleep, they cannot get to sleep. And because of their anxiety. They're having panic attacks. It's really impacting their ability to function as a kid. And so for kids function, that usually means school or doing activities with the family, going out with friends. These are kind of the functioning we talk about for children. Then it's time to probably see a psychologist or a psychiatrist like myself. And that can be done in kind of the outpatient setting, getting a referral through your pediatrician. In San Diego, we're very lucky though, because we have a walk-in clinic for mental health. So in Mid-City, there's a Radies Behavioral Health Urgent Care. You can walk in, you can call and make an appointment and get immediate help. So the question though that got asked, which is tying right in, is when do I go to an emergency room for a mental health issue? And so really, that's when there's a concern about your child's safety. So if you're concerned that your child is having thoughts that they might want to hurt themselves, they're talking about suicide, you're concerned about suicide, absolutely you want to be taking them in for an urgent evaluation. If they're also talking about hurting somebody else, potentially they're getting really angry, irritable, or they're acting out and physically hurting people, injuring other students, injuring yourself as parents, you don't feel safe with your child, which is an unfortunate reality a lot of families do face, then that's the time to think about getting some more emergent help coming into the emergency room. Or if your child's really not behaving like themselves, potentially they're talking about something that we call psychosis, being out of touch with reality, seeming confused, telling you they're seeing or hearing things that don't seem to be reality based. That's another reason to come in for a real emergent visit to the emergency room so that we can see you urgently and see if we can help.
One other more serious concern that has arisen, I believe you were speaking on national news yesterday about fentanyl in the schools. If you could just address that.
Yes, a lot of you have probably got a note home from school warning you about rainbow fentanyl, which is fentanyl pills, and fentanyl is an opiate or a pain pill that are coming in many different brightly colored versions right now, or chalk versions. And the concern being that this might be more appealing to children and youth. And so one thing to kind of keep in mind when we're talking about children and youth is we've been focused on mental health, but obviously substance use is a big part of this too for older children as well. So using this kind of time where we're getting warned about rainbow fentanyl as an opportunity to review just general safety with your children around substances and drug use. Talking about it doesn't make anybody use it. I know sometimes families, get concerned, well, if I tell them about it, are they going to be curious? We just know that's, not how it works. So having an open conversation and letting them know, hey, there's this opioid pain pills are really dangerous. If you take them and you don't know what's in them, you actually can die. So the stakes are very high. And for those of you that have been following the news, there were unfortunately some cases of overdose deaths in Los Angeles County of youth related to opiates. So it's incredibly dangerous substances that are out there right now on the streets. So it's really important that we make sure that our children and youth are aware about these dangers. But at the same time, I don't think we need to get too concerned, because one of the kind of more obvious thoughts is fentanyl is very expensive. So nobody's going to be leaving it out on the street. No one's going to be handing it out as Halloween candy, trying to trick children. So I don't think that fear is really appropriate, but I do think it's really important to make sure that we remind even our younger children, don't take pills that you don't know where they're from. Make sure you're getting it from a doctor, a prescription, or you check with me as your parent, and just use this as an opportunity to have that conversation again with your children or your adolescents.
Noting that we just have a moment or two left, I know you also had some books that you wanted to share in terms of resources, and I'd love to see those.
Sure. So I focused on anxiety. There's really excellent resources, and this is something that a school counselor or pediatrician can help with too, because you go on social media, you go on the internet, you could be inundated with advice, and it's so hard to sort through, should I do this? What type of parenting approach should I take? Where to even start? It can be incredibly overwhelming. So I wanted to bring 2 books. They're available at the library as well, or of course, off Amazon, or as we say, support your local bookstore. But I wanted to share. So one is just a general book. I'll hold it up. It's called Breathe Like a Bear. The author is Kira Wiley, and it's mindfulness exercises for children. So I'll show you a little bit. Like, here's an example of an exercise, really playful, could benefit any child. probably, over 12 might find it a little bit too juvenile, but for that elementary school age, it's a really excellent book just to learn some skills to manage big emotions, which we all have. The other workbook I brought that's really good for anxiety, and especially back to school anxiety, which you can get and work through as a parent. It's meant for like a parent to work through with your child. Some therapists will do it as well. Is this workbook? It says What to Do When You Worry Too Much, A Kid's Guide to Overcoming Anxiety by Dawn Huebner, a psychologist. And it's like just a workbook. Children can fill out things and work through with parents. Really friendly language, really goes off that how I spoke about fighting back against anxiety and kind of recognizing that your anxiety doesn't mean something's necessarily bad or that it's right to be fearful of. So this book really works on kind of those principles and is really effective in helping children learn some of those skills to tackle anxiety. The other book I brought, because I figured most of your podcast listeners are probably highly motivated to be tuning in. It's a little bit more academic based, but it is meant for parents. So it's Treating Children and Adolescents' Anxiety, A Guide for Caregivers. It is a little bit dense, but it has really, really excellent information on how you as a parent can support your child, exercises you can do. And it is a whole section on back to school anxiety. I mean, you can see I use this book a lot. So this is a good one, but I do warn you, it is a little dense. And this was obviously for you as a parent.
Dr. Jenkins, if I can, I want to hold you just for another moment or two to help respond to a couple of questions specifically, and I appreciate your time. Noting Rady's long wait list, how can we support a student who's being aggressive at school, has been expelled from more than 5 preschools, 4 years old?
Goodness. So that's going to be a difficult situation. So for a 4-year-old, we should keep in mind that here in San Diego, we are lucky because we do have First 5 San Diego. So that's a county-driven resource to help support any children with any type of behavioral difficulties. So acting out as you're describing in a 4-year-old would count under that umbrella. And acting out, I guess I should say, can be for so many different reasons. So my biggest thing I say is if you have a child who's acting out, do not label them as a bad child. There can be so many reasons why you're seeing that type of behavior. They could be anxious, they could be depressed. I know it's hard to think a 4-year-old could feel that way. They could have some type of a learning disorder or processing where they're not taking information in the right way. They could have a developmental disorder of some form. So really, they need a full evaluation to find out what is the cause of this behavior. And then you can target a treatment plan to support them and help them in the school. So I would really advocate for a really comprehensive evaluation to try to understand what's going on. That could be possible through Rady's. We do have a wait list, like you said, but for the younger age, I actually find the programs through San Diego County, like First 5 is the best place to start. And there's also the regional center if the child has any type of developmental needs as well that can support these type of evaluations, and getting a sense of what it is that's driving it so that we can all be better equipped to help support that child. And the thing too is if you're seeing a 4-year-old, oh my goodness, there is so much hope because there's so much opportunity for intervention with the little ones. And we can really see some great successes, especially when we're kind of able to early identify some of the needs or difficulties that child's having. So that would be my recommendation there, is to really try to get that thorough evaluation done.
This is great. Last question, if you will. I appreciate it if you're able to lend yourself. A 5-year-old developed a fear of choking over the summer with building anxiety around starting school. This led to not eating solid food for a couple of weeks, beginning of September. And again, this is more probably necessitating a thorough, broad evaluation to understand, but please.
Yes, so this is not uncommon in my line of work. This is something that we have seen quite a bit of. The fear of choking, fear of vomiting as well comes up, limiting the child's ability to eat, driven by anxiety, about something that could be seemingly unrelated, like going back to school and choking doesn't necessarily seem too related. The good news is this is very treatable, especially through therapy. There's a lot of different therapeutic exercises that can be done to help a child with this type of struggle, particularly something a psychologist can help with. If it's progressed to the point of where they're not eating or worried about their nutrition or their medical stability, we actually do have a program at Rady's in the hospital. We have a medical behavior unit that's just focused on feeding and eating issues. And so it includes things like avoidant restrictive intake disorder, also going up to eating disorders. But some of the children that have maybe a different specific phobia, like a fear of choking, fit into that. And there's some really, really excellent therapies that work very well. So that's something that we do see. You're not alone. And there's very effective treatments for that. So I'd absolutely, if you haven't already, suggest getting in to talk to your pediatrician, getting connected with the appropriate help, because we do have really good help for that here in San Diego.
And when an evaluation is done, the parent can sign a release so that information can be imparted to the therapist that they may be working with. There was a question related to that kind of collaboration. That would be my understanding.
Oh, absolutely. I'd encourage any parent to be open to the sharing of information between medical or mental health professionals. And also the other piece that comes up related to that is just not to have too much fear about sharing information with schools. I do come up that a lot where families are very nervous that, oh, if I share my child, has a struggle, will the school penalize them in some way? Will they be judged in some way? And I want to assure you that the incidence of mental health concerns is so high right now that your child isn't by far not the only one. And by not sharing with the school, you might actually be hurting the child in some way with the recovery and treatment, because the teacher might respond in a way without information that could help them or help support your child. So not saying you have to share all the details, but definitely giving school a heads up, some element of the struggles your child's going through can be really helpful too. So yes, you can sign releases. There's lots of ways that records can be shared.
Dr. Jenkins, this has been wonderful. You've shared so much in terms of tips, resources, strategies. Very helpful. I greatly appreciate how you've lent yourself to provide this, and also just truly thankful for the service that you provide in the community to families and children. So thank you so much for joining us today.
Oh, thank you so much for having me on. It's really my pleasure. I'm very passionate about this work.
Well, thank you. And those that were able to join us, thank you for joining us, and we'll be well until the next time we can come together. So thank you very much.